Okay, we're going to show you a simulation of what the pharmacy activity is going to be like. And you're going to have a group of 5, but there's just 2 of us here to simulate this. You're going to have a case, and the case is going to actually be kind of highlighted for you. So you'll see the red areas that look like important things, pieces of information you need to know for the case. And we're going to kind of discuss this, and then we'll go through the whole case, and at the end we're going to decide if there's any medication changes if needed, and then we're going to simulate, or actually use our cell phone when you're in the room to call a pharmacist downstairs, a student downstairs, and give your new prescription to that pharmacy student. So here we go, discussing the case. Okay, so she's 55. Here are her BMP and lipids that we're looking at in a UA that she did a few days ago before she came in.
And today she's here because she's tired since she was here last 3 months ago.
She's worried because her urine's darker than usual. She hasn't had any energy. She's only 55, but she already has osteoporosis and a diagnosis of dyslipidemia.
Okay. And her father had colon cancer, it looks like. She's allergic to sulfa.
She's already taking simvastatin 40 milligrams and Actonil for osteoporosis.
So she's here complaining of fatigue. Activity does not make it worse, and she has not been snoring. She said her skin is slightly dry.
She's got some fullness feeling in her throat, occasionally choking with coughing, and
no real urinary symptoms except that she hasn't been voiding as much during the day.
She's been kind of achy, but no known injury, full range of motion, strength's intact. You'll get exam results, and they show
vital signs look great. My skin is slightly dry with mild tinting.
So we need to pay attention to that. Her thyroid does look full on the left side when they do the thyroid exam.
So she has full range of motion of her joints and 5 out of 5 strength, even though she is a little bit achy.
Okay. So looking at her lipids, her LDL is not at goal on the simvastatin 40 milligrams. Her UA just shows a little bit of ketone, but no sign of infection. So what do you think we should do?
I think we need to rehydrate with oral fluids. Doesn't look like she has any signs of rhabdo. I do think as far as her medications that we should stop the simvastatin and let's use a stronger statin to get her to goal.
Okay. Her LDL goal with her being 55, osteoporosis, and already a known diagnosis of dyslipidemia, you should probably get her LDL under 130. So
Crestor or Lipitor.
If simvastatin hasn't done it, then we need to do Crestor or Lipitor. So let's try Crestor 10. We also need to follow up on her fullness in her left lobe, so we should add a TSH to her labs and a CBC for the fatigue.
When should we have her come back?
We want to do a recheck CMP in 6 weeks and also check a fasting lipid profile in 6 weeks. Okay, so we're going to change the medication. We're going to take that new medication. We can either write out a script if that's what you want to do to feel more comfortable, or just pick up the phone. There'll be a phone number to dial, and you will call a pharmacy student downstairs and call in your script. So I'm going to simulate that. You'll have one group leader that's going to be designated per group to make the call. You can just decide that yourselves. Hello, this is Kimberly Lay, PAC, calling in a prescription to the pharmacy for Delta Dawn. Her date of birth is 3/8/58. She has she has an allergy to sulfa. I'm calling in Crestor 10 milligrams once daily, number 30 with 5 refills. Okay. And during the phone call, they may ask you questions about the patient's case. They'll actually have the case downstairs with them too. And so they'll say, well, have you considered what her GFR is? And you could tell them, because you'll have the lab result. You can let them know what the GFR is, that you're not concerned, or if you are, what that may mean when your follow-up. So you might have a little bit of discussion. You'll have about 5 minutes to make the phone call and the full discussion with the pharmacy student. and then you'll hang up the phone and you'll go on to your next activity in the lab activity hour from 11 to 12. So your proctor will let you know when you need to do this activity, and we'll give you the case. Okay, so that's kind of a description of what the pharmacy activity will be. If you have any further questions, please let me know in class, or if you have a real concern, go ahead and email me any questions you have. Thanks.